Well, good afternoon, everyone. My name is Ricky Telg. I'm the director for the UF IFAS Center for Public Issues Education and Agriculture Natural Resources, or as we call it, the PI Center. I'm also part of the outreach core for the Southeastern Coastal Center for Agricultural Health and Safety. And it's my pleasure to host today's webinar. The title of that, as you see on your slide there, is Update on Avian Flu, Influenza H5N1 and biosecurity protocols. We're scheduled to run from 1 o'clock to 2 o'clock Eastern time today. And how things will work today is that if you have a question for any of our three speakers, whom I'll just introduce in just a second, that I ask that you place that in the Q&A. And then at the appropriate time toward the end of the webinar, after the three speakers have had a chance to present their information, we'll go through the questions at that point that you've put in the Q&A. There will also be a link and a QR code to a post session evaluation. And at the very end, we'll also provide you with some more resources related to H5N1 overall. So with that, I'm going to introduce our speakers today in the order that they will be presenting. Again, today's topic will focus on an update on avian flu, as well as what Extension faculty have been doing in regards to biosecurity protocols that have been implemented this spring during spring fairs and livestock expositions. So today's presenters are Ben Anderson. He's an assistant professor in the UF Department of Environmental and Global Health. Isabell Revere, who is a master's student in UF Public Health, and Colleen Larson, the Okeechobee County Extension regional dairy agent there. So with that, I'm going to turn it over to Ben, who's going to give us a kind of an update on where things are related to H5N1. Ben?
Thanks so much, Ricky. I'm going to share my screen and get my slides up here real quick. All right, just confirm slides are visible.
Okay.
There we go. All right. Wonderful. Thanks so much for the introduction, and it's great to be here. I want to just preface this by saying that we're going to be sharing some updates today that are post the last webinar that we had in February. And also prior to that, we had another webinar back in November of 2024. And I want to highlight those two dates for folks that may be joining for their first webinar right now. If you go back to those previous webinar archives that are available on the website, you'll be able to catch up some information there, including for the November webinar. It gives a lot of information about what influenza H5N1 bird flu is and some of the basic knowledge that is centered around that. I'm not going to share any more of that information since that's already been discussed. What I'll talk about today is essentially what are the updates since the last time we've had a webinar, which was in February, and some of the key pieces of information that we think that are relevant to share with you. First of all, just kind of a situational update is that we haven't seen any increases in human cases of H5N1 detected in the United States. There's a little bit of thinking that that might be because some of the surveillance is not happening the same way it happened maybe last year, or there's some shifts in programs giving some changes in the national landscape. But we haven't seen new cases recorded. It's still holding steady at 70. But we are still seeing some data that's being reported and coming in at a steady pace for some of the other species that we know are impacted by H5N1. Our wild birds being the primary migratory transmitter, they're migratory species, and bringing the virus into the country or moving it around through those migratory bird pathways. We're still seeing wild birds being detected with H5N1 in a variety of different locations in states. And the data is still updated on the USDA website. And so you can go there and you can see what's been posted and what those dates and locations and what species have been impacted through that website, which is available here through the link on the bottom of the screen. And there's links to the websites for all the references in these slides, which will be shared after the presentation. For poultry, that's the biggest story that we've been paying very close attention to. We talked about this in our last webinar in February because over the months of December, January, February, we saw a very large increase in poultry outbreaks happening, particularly among very large operations. And this is primarily impacting the layers, egg laying operations, where the USDA policy is that if a case occurs in any one bird in an operation and it's identified, then the response policy is that all of the birds are to be culled and removed. And so that's hard enough with smaller to medium-sized operations, but it's an incredible challenge with operations that are 1 million plus 2 million birds. It's just logistically and psychologically, it's just a really devastating thing to do. So this has continued to be a very big concern, and since February, we've still continued to see impacts on the egg-laying poultry industry producers, including some larger operations that were even more recently impacted, which I'll share with you later in the screen, in the presentation on the slides. For our dairy herds, we're still seeing cases occur, though I won't say it's as much as we had been seeing it reported in the earlier part of the year, though we are still seeing some steady cases being detected in some certain states. And so you can see here on the last 30 days slide, 18 new confirmed cases in 2 states, California and Idaho, but we're still seeing some impacts and pop up in different parts of the Western United States. And that's something that we're going to continue to watch closely and pay attention to regarding the circulation of the dairy variant of H5N1, as well as some of the new information I'll share with you about some potential crossover of the virus from migratory birds into dairy farms. And then lastly, our mammalian surveillance also is still has a steady detection rate, looking at some very different species, small mammals, as well as some domestic cats that are continuing to show up as positive. And this is, again, different parts of the country, different states, happening in different species. So what that indicates to us is we're probably not capturing all of the transmission that's actually occurring. This is really just the tip of an iceberg or a snapshot, but it gives us a sense that given how much virus detection we're seeing in the domestic livestock, as well as our wildlife, mammalian species, domestic cats, this virus is still pretty ubiquitous, means it's pretty widespread. So I'll jump in just a couple of key events, notes, key references of note and that I want to highlight today. The first of all is that I mentioned the idea of a variant, or we have some different variations of different kinds of H5N1 bird flu that's circulating. The analogy that's been used in the past, I like to continue to use is flavors. And so the dairy flavor was one that was identified to likely have been introduced by probably migratory birds back in 2024. And that strain of H5N1 began to spread among the dairy operations, but that was contained within the dairy operations, transmitting from farm to farm, whether that was from animal to animal or from fomites, trucks, or other contamination happening. Those were the different potential transmission routes. But what we were not seeing is a reintroduction of virus from migratory birds into dairy farms like we see with the migratory birds introducing it into poultry operations, except until earlier this year, we started to see the D1-3 show up actually in milk. And this happened in 2 states where they were doing the milk testing through the FDA program, or the USDA milk monitoring program. And we start to see that migratory bird strain, the D1 strain, showing up in the milk. So that was indicating that potentially that there's a cross circulation of the strain that circulates in migratory birds with the cattle and vice versa, which creates concerns about migratory birds being able to transmit what's been impacting cattle, dairy cattle, very efficiently, being able to move that to different parts of the country. Now, we haven't seen that show up anywhere else to date, so that's good news, but it's something we're going to continue to track. but we're also wondering about differences in infectivity of both the bird and the dairy cattle strain in people. Most of those 70 human cases have been caused or have been reported as associated with dairy operations. Only a couple have been associated with this D1 strain, which is more circulating in the migratory birds and impacting poultry. But we've since started to see confirmation of this genotype showing up in certain human cases. Again, we haven't seen human cases detected since our last webinar back in February, but it's something that we want to continue to monitor. Also, I just want to highlight serology is one way. So that's where you take blood samples from people and or animals and you look for evidence of infection, which would mean that we test that blood for antibodies. And if an antibody is detected specific to a virus, that's an indication that that animal or that person was previously infected and their body was mounting an immune response to the infection. And so we don't have a lot of serology studies because they're difficult to do. They're very technical and the laboratory expertise is more complicated. But what we have seen, though, is that we start to see serology studies, the limited ones that have shown up, starting to see some exposure where they don't have known exposure sources. And so this indicates that potentially there could be some transmission pathways that are not very clear, or there's some cryptic infections happening where people might be infected and they don't have clinical signs. So this is, again, another tool that we want to continue to try to deploy in epidemiology to have a better understanding of what the true transmission risk is for this disease. Now, a couple more practical things on the production and risk management side. There's been a number of studies that have been published that I think are really important to note around thermal stability of H5N1 in raw milk and other products that might be sold or consumed by the public. And so this is, of course, a very important question, one that was asked very early on last year after dairy farms were impacted. And it was shown very quickly that pasteurization is an effective way of eliminating live virus from milk and other products, which is really important to note, meaning that those products are safe to consume. But that still continued to have some questions around the study of raw milk or products that use raw milk, because that we know that those products are still sold and or consumed by certain populations of the public. And so what is the risk of that? Really having a clear picture of that. So this study here by Cornell was suggesting that the aging process is not enough and alone and effective in completely eliminating viable H5N1 from raw milk cheese. So that's an important note to understand some of the prospects around the raw milk cheese production section of whether or not those are risks of consumption. And so there's an understanding here that there hasn't been any cases associated with consumption of cheese produced from raw milk, but it's important to follow this up with some other risk assessments to make sure that there's not going to be any risk or association with persistence of the virus in that product. There's another really good paper that was published here, which has a really good chart, and it's a good reference chart for those that may want to look at this. Maybe people ask you, what is the appropriate temperature to inactivate H5N1 from milk or other products with milk in it. And so the first chart here is showing essentially what's called a kinetics chart. And these researchers took H5N1 that was in milk from infected cows and also had milk that they spiked with H5N1 that they had in the laboratory. And they put it at different temperatures over a 56-day window to see how long the virus stayed viable, how long it was still able to be infectious. And one of the kind of striking takeaways from this is the 4-degree data showing that it essentially maintained viability, though it had reduction of viability, but it was still viable up to 42 days post-inoculation in the 4-degree setting. So saying that, there's likely a continued risk of exposure to H5N1 that could be infectious if the milk is only maintained in a 4-degree setting. Other temperatures are listed here, but also showed viability at 20 degrees, less so at 30, but still over a couple of days, and then starting to see a drop off as the temperature goes up. But what was really important here is they also tested again the pasteurization temperatures around inactivation. And there's been multiple studies that have done this. There's also in this paper references that cite those studies as well. But what's great is all the studies are validating that both regular pasteurization per the FDA definition, as well as ultra pasteurization, are effective means for completely inactivating the virus from the milk. There's another study that came out that replicated some of these findings as well, again showing that 4 degrees in raw milk contained viability over a longer period. Now, this study was a shorter period than the other one. The other one was 42 days. This one showed viability up to 7 days at 4 degrees. So there's some variation there. But they also looked at room temperature and were also able to show that there was viability maintained at room temperature as well. So coming up to the end of some of the key references here is, I think this is a really important paper that was published. It's a review paper that looks at essentially bird flu over the last 25 years and its evolution and spread. And the key takeaway here is that we have seen a marked increase of spread of H5N1 over the last 5 years. And that has predominantly been presented in a huge spike in the number of mammalian species that have been identified to be infected with H5N1, in addition to the geographical range. So here from 2020 to 2024, just a massive rise and increase in mammalian species detections and locations in which that's occurred. Now, when we do epidemiology, we always have to be aware that sometimes maps and data can be impacted by just an increase in the amount of surveillance that takes place. While there might be some of that, this is, I think, it's not just an artifact of people more actively looking for it. It's definitely a true spike and a true increase, which follows along with the genetic changes that were identified in 2020 to 2021 that show that the virus is able to more easily bind to and infect mammalian cells. Another, I think, important reference to note is colleagues out of the University of Maryland put out a review paper where they looked at influenza infections among domestic cats. They include feral cats as well, but this was influenza, specifically H5N1. And what they noted in their data was that there was a marked increase of infection from H5N1 among cats in 2023 and 2024. And that trends along with what we see from the USDA data, as well as some other anecdotal data that we're seeing more cats showing up with H5N1 infection. So this is highlighting again the domestic cats being a potential transmission pathway of concern. We know that cats can be exposed and infected when they're exposed to raw milk that's infected, but we also have a lot of cats that have been identified that have no known exposure to livestock or raw milk. And so they're getting infected in different ways. Whether that's from exposure to migratory birds, other wildlife, it's not so clear. So this is an area that we're going to continue to explore to better understand. And then just coming back to some of the more recent news again, a large impact on the egg layer poultry operation in Arizona, a 6 million bird operation, completely lost all their flock. Again, huge devastating impact to the industry, but also just the psychological burden to have to go in and call a flock that large is just very devastating. I can't underemphasize that enough. So this has really, I think, pushed the conversation even further into discussing other avenues and policies for how to respond to H5N1 in poultry operations. There's not a conclusion to this discussion yet, but many are calling for the potential to change the policy to include vaccination of minimally egg layers in the poultry industry. There's some support for that, but it's not something that's decided or has moved in terms of a policy direction. But these events are continuing to precipitate that discussion. And then on the vaccine side, there was news that Moderna's vaccine that they were developing, which is an mRNA vaccination technology, similar to what they've used for COVID-19. They had a contract that was canceled. Their work continues, and they do have some product development that they've made progress on. But there's also some other companies that have also been working on vaccinations. There's a really good article published just recently that identifies some of the early successes to a bird flu vaccine for cattle. And so this is something that would maybe be better in a cattle setting, given the epidemiology and the circumstances around how the virus impacts cattle. But this is, again, progress being made on the vaccine development side for cattle. Still poultry, there's work being done there, but whether or not it will be used, that's a policy question that's still ongoing. And then lastly, some proposal funding updates. USDA early on in the spring or right before spring started, they announced their emphasis on wanting to have calls for proposals to help with particularly the impact on the egg laying industry. And we have since seen a USDA funding call with a substantial amount of money allocated to that. It's $100 million. That had a focus on biosecurity, vaccine development, and emphasizing transmission pathways in other species. So trying to figure out how is H5N1 getting into the poultry operations, even though a lot of these operations have increased biosecurity substantially, have put in all these recommendations, but they're still seeing outbreaks occur. So that speaks to the idea that we need to have much better study of transmission pathways and dynamics to really be sure how H5N1 is actually getting into these operations so we can target interventions more specifically. All right, with that, that's all the updates that I have. Thank you.
Great. Thank you, Ben. Thank you so much. Again, if you have questions, please put your questions in the Q&A. After the other two presenters have presented, we'll have a time for questions for everyone. So if you have something on your mind right now, don't delay. Go ahead and put it in the Q&A right now. Now we have with us Isabell Revere. Isabell has been working very closely with Dr. Cindy Sanders, who's our livestock agent, also the Alachua County Extension Director, implementing a biosecurity plan for our spring fairs and exhibitions around the state. Cindy was not able to be with us this afternoon, so Isabell is going to share information that she has collected, she and Dr. Sanders as well. So Isabell, it's all yours.
All right, I'm going to go ahead and share my screen. All right, let me know if y'all can't see that. Okay, perfect. So my name is Isabell Revere. I'm a Master of Public Health student at the University of Florida, and I've been working with Dr. Sanders in the UF IFAS Extension, developing a biosecurity framework for livestock exhibitions. So this was discussed in the previous webinar, but I'm going to go ahead and give a little recap in case you weren't there or you need a refresher. There we go. Okay. So the objectives of this project were to develop a biosecurity framework for livestock exhibitions. And then I implemented it at the Alachua County Youth Fair and Livestock Show with the help of the fair board members and Dr. Sanders. And then we analyzed the efficacy, knowledge attainment, and overall satisfaction with the biosecurity measures that we implemented. And the significance is that there's no established framework out there that is publicly available for livestock exhibitions. So there are guidelines and general things to follow, but with respect to a specific framework or template, there are some for on-farm frameworks, so on a dairy farm or on a chicken farm, but there's nothing for livestock exhibitions, and so no frameworks address the unique challenges of these events. And with that, livestock exhibitions are high-risk environments. So you have people and animals coming from multiple different locations, and we don't know what their biosecurity is like at the home facility. And then again, with non-terminal shows, if we have animals that don't go to market and they're sold into maybe the commercial industry or they go back to their home facility, then they could introduce any pathogens that they contracted at the fair or exhibition to their home facility. So because of the high risk environments, it's even more crucial to have proper risk management in place through biosecurity. So for the framework is designed as an interactive guide. So it's a checklist. You can see a picture of it on the slide, and there's some fill in the blanks as well. And what it does is it takes you through different sections and considerations to think about when developing a biosecurity plan for your event. And the result is a comprehensive biosecurity plan specific to your event. And at the beginning of the framework, in the introduction, it's emphasized that this is a flexible framework because it's not feasible to implement every single biosecurity measure that's mentioned, and it's also not always necessary, right? So it's up to fair staff and exhibition staff to realize what are the risks they're concerned about and what are they able to implement to help mitigate those risks. And then some important sections include pathogen risks, visitors, exhibitors, animals, emergency response, and preparedness. So what do we do if there is an outbreak? Okay, so moving on to signage. So signs are included as a part of the framework, and these can be used as is, or they can be used as an example when exhibition staff are developing signs for their event. And this just helps think about, okay, what should we consider? What signage do we need at our event, and help decrease one less barrier to implementing these biosecurity measures. And then let's get to implementation. So this was at the Alachua County Youth Fair back in the end of February, beginning of March. And so there was sort of a three-step process to this. So before the show, we sent out information to exhibitors and guardians via the email survey, just with what to expect at the fair. So what biosecurities were in place, why we were practicing biosecurity, what biosecurity is, what is avian influenza, all of those sorts of things, because the goal of our project was to prevent outbreaks of zoonotic diseases, but specifically avian influenza. So we wanted to give them some background information. And then there was also a health declaration that was sent out. And this was basically like a symptom and exposure check for exhibitors and guardians to fill out and say, have you had exposure to someone or a farm with avian influenza or other zoonotic diseases? Is your animal experiencing any of these symptoms? And that was sent out prior to the fair. And then during the animal check-ins, we went basically vehicle to vehicle before people unloaded their animals to ensure they had filled it out. And if they hadn't, then we had a QR code that they could fill out. And then during the show, after meeting with the fair board members and community members, we determined what measures we thought were feasible and necessary for the event. So the poultry area was moved back away from the entrances to try and prevent visitors from entering that area. And then it was restricted to only poultry exhibitors and guardians. And then we had foot baths in the poultry area and in the swine area. We had hand sanitizer throughout the barns. And then we had signage that just said like no food or drink in animal areas, use hand sanitizer, those sorts of things. And then we had a new poultry check-in protocol. So instead of everyone bringing their birds and creating a crowding situation, which is stressful to the birds, but also allows for disease to spread, we actually had people come up and make sure they filled out the pre-show survey, and then we escorted them back to their vehicles and did a quick visual symptom check to make sure their birds weren't displaying any symptoms before bringing them in, because that helps us ensure that no sick birds are entering the facility. And luckily, we didn't have any birds experiencing symptoms. And then we also implemented a new poultry waste protocol. So before, people would just throw shavings, manure, old feed, and water on the ground, and that can result in environmental contamination. So we had buckets and scoops to collect waste like that. And then after the show, we sent a feedback survey to all the exhibitors and guardians to gauge their overall satisfaction with the biosecurity measures. So this is the information and survey. These are just an example. So the pamphlet that you see is what was put in all exhibitor packets, as well as it was passed out at the fair. There was an information table where visitors and guardians could grab a flyer as well. And then the survey, so this questions and symptoms were specific to avian influenza, but they were also specific to the species. So exhibitors would check which species they were showing, and they would get questions related to that species. And both of these are included in the framework as just examples of things to have at the event. And then implementation. So these are some pictures I took at the event. So in the rightmost photo, you can see someone using hand sanitizer prior to entering the poultry area. You can also see one of the signs that we had up, and then the black pad in front of her was the foot bath sanitizing pad. So people were supposed to step on that before entering the poultry area. Then in the photos, you can see that the flagging tape where we had the poultry area marked off from non-poultry exhibitors and guardians. And then you can see, looking at the floor, there's not that many shavings on the ground, which was a pretty good indicator that people were using the buckets we had to collect waste and not just dumping it on the ground. So now I'd like to get into the results of our study. So overall, with efficacy, we asked people, what biosecurity measures did you comply with? And then how often did you comply with those biosecurity measures? So in general, our efficacy was pretty positive. We had 88% of people say that they completed the pre-show survey. 62% said they followed signs, 54% said they used hand sanitizers, and 46% said they complied with the foot baths. So foot baths were perceived a little bit lower, and that's a general theme we see throughout the rest of our data as well. And then when asked how often people complied with the biosecurity measures, this was also received very well. 34% of people said all of the time, 33% said most of the time, 21% said half of the time, and then only 4% said never. So in general, people were following the biosecurity measures that we put into place. And then moving on with more quantitative data with knowledge attainment. So we asked how informative the pamphlet was that we put in the exhibitors' packets, and then also to what degree the information we sent out increased their knowledge of biosecurity and avian influenza. So 95% of people said that the pamphlet was informative to extremely informative. So in general, it was very well received. We were happy to see that. And then 64% of people said their knowledge of biosecurity increased to significantly increased, and 67% said their knowledge of bird flu increased to significantly increased. So in general, knowledge attainment and education materials were perceived very well. So we were happy with this as well. Then with satisfaction, we asked poultry exhibitors and guardians specifically about the biosecurity measures because they had extra measures in place. So we tailored this question and it was only sent to poultry exhibitors and guardians. So we had about 40 poultry exhibitors and 9 of our survey respondents were poultry exhibitors and guardians. And in general, people were very satisfied with the measures. So with hand sanitizer and the buckets for waste and water, people were extremely satisfied to satisfied. And then with restricting the area and the check-in survey, again, people were extremely satisfied to satisfied, but we did have one person say that they were not satisfied with either of those. And then with the foot baths, they were, generally well received, but we did have 2 people say they were not satisfied with the foot baths. And that's kind of a general theme throughout all of our quantitative and qualitative data. So moving on to qualitative and observational data. So the quantitative data was received in the survey that was sent out after the show, and we had about 27 respondents, which was to be expected for a voluntary feedback survey. But at the end, people had the option to leave qualitative feedback. So these are things that people mentioned in that box or that I saw while at the event. So with foot baths, these were not as successful as I would have liked them to be. People were stepping over them or didn't want to step in them, and they were hard to maintain. And the biggest issue was that these barns had a dirt floor. So with a concrete floor, it's a lot easier to maintain the foot baths. With the dirt floor, people's shoes were getting muddy or the foot bath itself was getting muddy. So if we were to replicate this again in a dirt floor scenario, I would recommend using garden sprayers to spray off boots or using a dust bath. So they actually make a dust type chemical that you can dust your shoes in that works to sanitize them as well. But if we were working with a concrete barn, then likely the foot baths would have been more successful. And then with the pre-show survey, we had a few different comments about this. So some people commented that they were annoyed that they had to fill out the survey multiple times if they had multiple children. So in the future, that's an easy fix, just changing the survey formatting to where if there's multiple exhibitors, you can put multiple exhibitors per guardian on one survey. And then again, when we were checking the pre-show survey, going vehicle to vehicle, some people said, well, I'm hauling my neighbor's pig and I'm not their parent and the kid's not here. I don't know what to do. So with the multiple families in one vehicle, it can be hard to ask someone who doesn't know the situation to fill out a survey for a non-relative child. And so in the future, you could require that a guardian or the exhibitor be present at check-in. I know when I was showing, this was a rule that we had in place, either you or your parent had to be in the car, and that could help to have just someone who's aware of the situation and can fill out the survey if they didn't already fill it out. And then some people commented that they were hesitant to be truthful because they were worried that they wouldn't get to participate. And this is completely understandable. So with that, to make this a little bit easier in the future, just clarifying that just because you have a positive response, just because you indicate you were exposed or you have a symptom, doesn't mean that you're not going to be eligible to participate in the fair. So just clarifying that could help encourage people to be more truthful. And then with restriction boundaries, we had people who weren't respecting the restriction boundaries. They would go over or under the flagging tape. So with that, having a more permanent boundary like a fence panel could be helpful. And then some people commented, well, people didn't follow the signs or they didn't follow the measures. And at the end of the day, it was primarily just myself, so it's hard for one person to enforce all of these biosecurity measures. So having more staff could help improve enforcement in the future. So then some key takeaways are that this framework can successfully protect human and animal health, which is obviously the goal. But with implementation, you just have to do the best you can, right? Nothing's going to be perfect. Some people aren't going to comply. You're going to run into issues, and that's okay because something is better than nothing, right? And then when integrating public health into the livestock industry, you need to have that community involvement and buy-in, right? So we met with fair board members and got their feedback, and they said, well, why are we doing this? And we were able to explain, or they were able to be included in deciding what measures they thought were necessary. And that's crucial to help decrease resistance and overall improve acceptance of these biosecurity measures. And then zoonotic diseases will continue to pose risks for livestock exhibitions. So we need to be properly equipping exhibition staff with good biosecurity plans to protect themselves. And then with respect to future directions, we are working on publishing this framework in the UF IFAS database as well as in a scientific journal. So hopefully other people in Florida and or in other states, they can use this. And then in the future, there could be legal implications. So certain states or regional governing bodies could say, well, you have to have a biosecurity plan or you have to have an emergency response plan. So this framework can help exhibition staff get ahead and be prepared for any future legal implications. And that's all I have. So if you have any questions, feel free to drop them in the Q&A or shoot me an email and I'm happy to discuss with y'all. Thank you.
Thank you so much, Isabel. This is great information there based on a lot of research and implementation there. Again, if you have any questions, go ahead and put that in the chat, in the Q&A. Well, right now we'll have Colleen Larson, who is the regional dairy agent out of Okeechobee County. And she has a short presentation as well. And then we'll have a Q&A time for all of our presenters today. Colleen?
Okay, can everybody see me okay? I lost my Zoom screen. So Dr. Tell, can you see my screen okay?
I can see you. I don't see if you have any slides. I don't have any slides.
Okay. It worked when we okay,
Right.
let's try this one more time. There we go. Okay.
There we go.
All right, now let's try it. Okay, that's a little better.
Here, I can see everything now.
At one time.
Yeah.
All right, so thanks for having me back. I am the Regional Dairy Extension Agent in South Central Florida. And as we have already heard, this became kind of more of an issue, obviously because of the detrimental effects in the poultry industry, but also because of the dairy industry and the crossover into dairy cattle that happened last year. So just kind of an update of why this is important in the dairy industry, what's going on in the dairy industry, and then what we did through the exhibition season for dairy cattle. I'll just mention Isabell talked about the Okeechobee County Fair. The Okeechobee County Fair does not have dairy cattle at that fair. So we had to come up with some solutions prior to this for some of the fairs around the state that do have dairy cattle. Some of them allowed dairy cattle to continue, some of them did not, and that's what we've seen across the country, not just in Florida. So just kind of an overview of why the dairy industry is a little bit unique and some of the challenges that we're dealing with as this outbreak continues. Thankfully, we do not have it in Florida, and Arizona seems like a really far, and California far away from us. But as we'll talk about in just a second, it's still really close to home because of some of the things that happen in the dairy industry on a daily and weekly basis. So we'll discuss that in the first part with the movement of animals and around the country. What we are doing to monitor both cows and milk, some of the testing that took place through the fair season and that is ongoing for some other reasons, and then some biosecurity activities that are hopefully ramping up in the next several months and just continuing. So first of all, just a kind of a note for anyone that might not be aware, a lot of dairy calves are raised out of the state. So we have a challenging environment for raising dairy calves. Most of their feed, pretty much all of their feed, is grown outside of the state. So it makes it, between the heat stress and where feed comes from, it makes it very challenging to raise dairy calves. And so it may seem, hard to believe, but a lot of times it is more cost effective for a farmer to send those calves several thousand miles away to Kansas or Texas or somewhere for a good portion, several months of their early life from birth up until about 14 to 18 months old, and then bring them back at that time before they calve. So they're going, from Florida into potentially states that could have infections, and then returning before they calve. So also, cows leave dairy farms, so that's unique to the dairy industry as opposed to the poultry industry. At a poultry operation, those pullets, come in at a very young age, and they don't leave there. They don't move from one place to another. They spend their entire life there. So dairy farms, traditionally right now, they have a much lower cull rate, a lot of them, because a lot of herds, cattle prices are very high. It's hard for them to replace cattle, so they're not getting rid of as many cattle. But traditionally, farms have a 25 to 35% cull rate. That means that they turn over 25 to 35% of the animals on their in their herd every single year. So those animals are moving off the farm. Mostly directly to a slaughter facility, but a lot of times to a livestock market or an intermediary place in between. So an opportunity for commingling, or an opportunity for those vehicles and, potential fomites with people in and out of vehicles at a same location to go back and forth to a farm. Several farms have multiple facilities for animals that are dry or for calving. So again, just the movement of vehicles, movement of animals back and forth. We also have a unique situation in the state where we have a very large population and a decreasing number of dairy farmers and dairy cows. So we have a lot of milk coming into our state from other places. Most of that milk is coming in on a tanker truck as raw milk, and then going to be processed at a processing facility. Some of it may come in already processed, pasteurized, and ready for sale. So those are just, a couple things that are unique to the dairy industry of why this is a big challenge, in addition to what Dr. Anderson already mentioned, that we don't have all of the answers of how this is being transferred. Just to mention a couple of the ways that these are just traditional ways that dairy farms observe what's going on. So at each milking, every single cow from every single teat, the milk is observed at each milking. So if there was a large incidence of abnormal milk, we would see it pretty quickly. And so there's there is concern that there isn't as much testing going on across the country. However, what is happening on farms has not changed, and that milk is still being observed 2 to 3 times a day on every single farm. The milk is also tested on farm, not necessarily for avian influenza like we did for a few months, or what's going on in some parts of the country where outbreaks are happening. But again, the milk is observed, and it's tested by the people on the farm, the hauler, and at the plant for safety for bacteria, and especially for antibiotics in the milk. Furthermore, there's growing technology. So several farms have recently implemented monitoring technology on cows. And so the interesting part, and why I'm mentioning that, is what we've heard out of some of the farms that have had this in other places that have monitoring devices is that the cow's ear tags or their collar alerts the farmer to a problem before there's ever any abnormal milk. So that's normal with these monitoring devices, that the cow's body is what is giving those readings for rumination activity, temperature, and other health, measurements and indexes. And so that technology knows that there is a problem before the cow starts showing any clinical signs of being sick. So as technology increases, there is a better chance that it will be detected very quickly. We're hoping obviously that it doesn't get here, but that it will be detected quickly if that happens. Okay. So just in the past, since really November, when some of this testing started, I think it was December that the USDA rule came into place that cows had to be tested before they moved. I'm not exactly sure where we are, which states are moving forward with individual farm testings and which ones have silo testing. But the rule that came out was that there had to be some form of testing in the state. As I mentioned, with Florida being a deficit state, that was a big challenge for Florida, the Florida dairy industry, because they knew that if the milk was tested at a silo and it came back positive, that there was a large possibility that milk came from a different state. And so there was a difficult time between the Florida dairy industry and the Florida Department of Ag to come up with a consensus of what to do during this time. Sorry, excuse me. So what happened during that time, because of the exhibition season and because of the location of other dairy farms, so specifically up in the Panhandle, there are dairy farms that have to have animals go across state lines for selling them. They don't have facilities within Florida, or they would have to go so much farther. So in that area, there was weekly, if not more often, testing of individual animals before they left the farm. This other cluster that you see down here around Lake Okeechobee, where I am, this testing all happened because of the exhibition season. So the only way that cows could be taken to a fair, according to the Florida Department of Ag, is if they were individually tested or if the herd participated in what was called a monitored herd status. So this required weekly testing of 24 hours worth of milk. And so that went on from November until the beginning of May. And there were 6 months of weekly tests that were negative around the state. That has since ended. And we do not have a current, statewide testing going on right now. In the Panhandle, that individual cow testing is still happening for animals that have to cross state lines, and the USDA rule for transporting animals across state lines or to something other than direct to slaughter, those requirements stay in place. So just to also kind of mention what we did, like Isabell said, we did not have a framework. And for the Department of Ag and the fairs that had lactating cow shows, some of them said, nope, we're just going to have heifers, so we don't have to worry about this. But for the fairs that agreed to continue to have lactating cow shows, we worked with them through IFAS Extension to come up with a very quick plan. How can we make this happen? And so we found out very quickly that we missed areas, that there were some areas that we just didn't think of. We had a lot of resistance. Like Isabell has the results from Qualtrics. I have more of the observation. I saw people that would not follow what we asked them to do as far as milk disposal. We did have the garden sprayers instead of the foot bath, just because we knew the amount of water and traffic and the challenges of a foot bath. Foot baths are commonly used on dairy farms with cows, and so we understood the challenges of foot baths already, and so we used the garden sprayers, and we had very mixed reviews of people being willing to use those. it does, require extra time and effort from exhibitors and the people that are showing their cows and in those environments. Also the people that work at the fair. So they didn't quite understand. So some education for the people that work at the fair is definitely something that we would spend more effort doing instead of just working with the fair administrators, because they're not the ones there at 6 a.m. when people ask, hey, why is this bucket of bleach here, or what's going on. So we learned quite a bit to, use the framework that Isabell and Dr. Sanders have come up with, and then implement how to specifically make that work for dairy shows in the future. So where we are now in the dairy industry is continuing to encourage biosecurity. So I won't go through all of this. It's just to present that dairy farms go through a pretty rigorous evaluation process through the National Milk Producers Federation program that is it's abbreviated FARM, for Farmers Assuring Responsible Management. And one of the pillars of this program is biosecurity. And it was originally developed to prepare for and recover from a potential foot and mouth outbreak, but it's been useful for farms to evaluate where they are as far as where their weaknesses are, where the potential problems are in their biosecurity plan. So since this outbreak has happened, there were several states that have required those dairy farms in those states to come up with a biosecurity plan, whether that was for moving animals or whether it was for exhibition. And the framework for coming up with this biosecurity plan for the farm has gotten a lot more participation as far as people being trained to go onto the farm and go through the process of evaluating a farm. And so I'll just share some of what happens through that process. So it's kind of broken up into everyday and enhanced biosecurity. So for the everyday biosecurity information, like a people entry log, who has been there, where have they been before that, and just keeping track of, the movement of people on and off the farm, reminders about paths, routes of exposure for animals and people, for disease transfer, for bird flu and other pathogens that can be transferred, and then the signage to remind people that these are areas that require clean clothing or PPE. In the event of a outbreak, that's when more of the enhanced biosecurity practices would be implemented on farms. And like I said, some states are requiring this for certain activities. And so that's an evaluator, someone who is trained to go through this process, would go onto the farm, starting with a checklist of, and this is just a snapshot, there's many pages of this to kind of go through the process of finding the weak points and then finding a solution and identifying locations for cleaning and disinfecting, and where traffic would be moved to, and where that disinfecting process would happen in the event of an outbreak. So this is one that I'll just share that we used before the exhibition. I worked with the with FDACS, with our FDACS vet, to provide this enhanced biosecurity as part of the process for allowing dairy cattle to continue to go to exhibition. They didn't require the entire enhanced biosecurity framework to be completed and inspected, but that is what is happening in some other states around the country, and will likely become commonplace at some point. So it's easier to be proactive and start it now instead of trying to play catch up when and if we get to the point that we are dealing with an active outbreak. So I hopefully got us on time, and with that I will end, and Dr. Telg will take back over.
All right, great. Thank you so much, Colleen. We have a couple of questions. We have about 5 minutes total. So we'll just go ahead and go through the questions that are in the Q&A. If you have a question, please feel free to put that in there. If we get to it, great. With no further ado, we have a question. I've heard that filtered air could be very helpful in preventing avian flu. Any thoughts? Ben, I think you would like to take that one.
Yeah, so there's a lot of study been done on airborne transmission of influenza. We know that flu does transmit readily in the air. Unfortunately, we don't have really good, strong studies in the current outbreak of H5N1 with primarily poultry operations. So there's been studies that have been ongoing for the dairy farms, but we imagine that it's not going to be different than historical epi data that airborne transmission does matter. But it just is more of a implication of management practices. For poultry, if the virus gets into the flock at all, it's culled. So air filtration is a risk reduction method. So it reduces the risk. It doesn't always eliminate it. And so that's why in the pig industry, it's definitely highly used and often used, and it's very beneficial. Poultry houses can use it too for other things beyond H5N1, but I think we're limited in our epi data to make clear recommendations on that right now.
Thank you, Ben. Next question, I think Isabel said that she would like to take this one. It says, given that preschool age children may not consistently follow biosecurity instructions and are generally more susceptible to infections, are they still permitted to attend these shows where exposure to H5N1 may be a concern?
Yeah, so at the Alachua County Fair, with respect to school children and preschool children, we did have people bring kids to see the fair, but we had a direct route. They weren't allowed to really walk through the animal areas, and then they kind of sat in the bleachers where they could see the animals, but they couldn't touch them, hand sanitizer, that sort of thing. So with respect to like visiting children, having a plan like that can make sure that those children who may be more susceptible are protected. And then also for us, we had the birds pushed back to a far corner where there weren't as many visitors, and it was blocked off to all visitors that weren't poultry exhibitors. So that can also help limit exposure to a specific pathogen like avian influenza, where we're concerned with it in the birds. With respect to like children and young children that were exhibitors, I actually found that they were more likely to follow the biosecurity measures, just from what I observed, especially if they saw adults, their parents, myself also following the biosecurity measures. They'd say, okay, I'll step in the foot bath because mom stepped in the foot bath. I'll use hand sanitizer. So in general, with having adults there and having myself there going, hey, just a reminder, use the foot bath, they were actually more receptive to using biosecurity measures. I felt like the younger children were generally more accepting to the biosecurity measures as opposed to older children or like high schoolers. So I don't think it should be that they're not allowed to attend exhibitions. It's just having those measures in place to prevent unnecessary contact and exposure would be helpful to prevent risk. I hope that.
I'll also mention, if you don't mind, Isabel, that also for all of these exhibitions, poultry and dairy cattle have been tested negative. So while we are encouraging excellent biosecurity with all of these, signage and asking exhibitors to do certain things, we are also bringing in animals that are negative for specifically avian influenza.
Great. With that, we're almost out of time. So I want to say thank you very much to our speakers today. You should be seeing on your shared screen there information, two things. One is the evaluation for today's webinar. There's a QR code as well as a link there if you just want to copy that or look at that. There's also some resources that folks on this call this webinar have helped to develop. We have two frequently asked question documents, one on more focused towards consumers and the other for those who have their own backyard flocks. If you go to that web page there, piecenter.com/resources/bird flu, you can download those two documents as well as look at the information there on the web pages. And we're in the process of developing an EDIS publication that's really an extension fact sheet related to the biosecurity plan template that Isabel and Colleen mentioned today. So there's a lot of information coming out to you and for you. So please feel free to distribute this information. We want to definitely be good consumers of information and also providers of information about both, in this case, avian flu and about this biosecurity template guidelines. So with that, we are out of time. Thank you again for being here today. Please go to the evaluation and complete that. And we wish you a very, very good Monday. Thank you.